Welcome to Doing Business with a Servant's Heart podcast. Doing business and life with a purpose, serving others and achieving success. I'm your host, Steve Ramona, and we created this show for you because we want everyone to learn how to do business and life to make an impact in the world. I want you to think about how you serve today and how you're going to make an impact today. And my guest, speaking of impact, because I think servant heart makes an impact in people's lives, is a true servant. And he's in the green room. We're talking about sports, and he's connected to sports like I am. Hey, Dave, welcome to the show.
Steve, you have the best title of any podcast that I have seen. And then when you tee it up like that and you talk about making a difference today, man, I'm just so grateful to be a part of your show.
Well, I really appreciate that. And to you in the audience, Dr. Dave as well. This guy has a PhD, so he's no lackey when it comes to education. Let's jump into the healthcare. It's an interesting industry. We all know drugs, and I listened to Aaron Rodgers yesterday talking about drugs and stuff, and talk about healthcare, where you see it going.
Yeah, it is an interesting industry, Steve. And I work in a small rural hospital in Northwest Illinois, and it's an especially difficult time for rural hospitals. Over 30% of hospitals are at risk of closing. Of rural hospitals are at risk of closing. And, you think about just the reimbursement and the expense structure, and something's got to change as we go forward. And it's more than just the hospital as an economic driver in the community, but you think about the distance that people have to go when they need healthcare, and it's such a vital part of a community and the health of a community. So I hope that our nation leaders make some moves that help to make healthcare more accessible and just move the needle in a positive direction for the patients that need it.
How long? I love that. How long have you been in healthcare?
Oh my goodness, I'm working on
You can
six.
lie if you want. I'm just kidding.
I'll give you the whole naked truth on if I can do that with a real quick story. I finished
Yep.
undergrad and I basically majored in track and field and fraternity. So I didn't have a lot of options on the table as far as what I was going to do going forward. And I went out to visit my mom and was playing in a pickup basketball game at a junior college. And the director of the X-ray tech program had a person drop out Friday, and I took that spot on Monday, and I fell in love with it instantly, Steve. I loved everything about the patients and the people that were working in hospitals and the environment. So I started that in 1984, and I've been in healthcare ever since. So I'm proud of that. I'm proud of the patients that I've had some small part in serving. It's a gift.
Man, it's a long time, so you've experienced a lot. If you had, you were the leaders or had a magic wand, what's one thing you would change in healthcare to help it, help it grow, get better?
I think we have to change the way it's paid.
Mm.
It's not a source of positivity for anyone. From the patient side, no one loves seeing these huge bills. From the provider side, we collect 30% of what we bill, and that's pretty usual in the hospital industry. Think about another business that writes off 70% of everything that they bill. And it's just because the way the system is designed. And I'm not whining about that, Steve. We've been very fortunate, but to be able to deliver the same type of care that our patients deserve, there just has to be some fundamental changes in the way it's paid for.
Deserve is a key word there. It's not they should have, or that's what they're owed or whatever. Deserve. And tell me about your servant heart towards your patients, because that's why you said that word deserve.
Yeah, that's why we're here. That's our mission, is we take care of our patients and their families. And I always add their families to that because for those of you that out there are parents, when you take a child into the hospital, it's worse for you than it is for the child. Oftentimes, it's scary. There's a lot of anxiety going on, and our job as people that deliver healthcare, whether we're on the front lines or whether we work in the back room, is to make sure that we take that anxiety down a notch. And when people come into our organization, we want them to know that they're loved and we care about them. And I've had the benefit of being in the same community for 35 years. And so the people that we take care of, oftentimes we go to the same church, our kids go to the same schools, we see each other in the community. There's 16,000 people in the town that I live in, about 45,000 in our service area. We employ 950. So, you do the math, and the families are throughout our entire communities that we serve. And I love that.
So, man, it's you got me speechless, which is very rare. So is rural different than, like, say in San Francisco? I'm in Bay Area, a hospital in San Francisco that's dealing with millions of. Is there a different way to run it, or are they pretty much run the same?
Well, I think the patient's at the center, regardless of where the
Yeah.
hospital is located, Steve, and that's what I think is most important. The thing that I love about a small hospital is we have an opportunity to do so many different things, right? As I grew up through my career, going from an X-ray tech to a director of medical imaging to a vice president and then a CEO, there are things that in a large academic medical center, for example, which you might be familiar with in the San Francisco urban area, you're very much in a niche and you have a very tight focus of what your expertise is. In a smaller hospital, you get to be more of a generalist. And I
Mhm.
think that's a choice that people make. I mentioned I've been here this long. It's either because I can't get a job or I love where I am. And I haven't interviewed for a single position internally or externally in the entire time that I've been here.
Well, that's incredible because I know there's a lot of burnout in healthcare, or change from hospital to hospital or clinic to clinic, where they do. Because I've talked to a number of people because of that. But here's the thing with healthcare that you mentioned a question that I think is so important. How do customer employment engagement connect? Because, I've heard people go to the hospital, oh, that nurse was just terrible, treated me like crap. My father-in-law was just in a rehab center, and that's all he complained about is how they treated him. How can we help that?
Yeah, so let's flip that. Let's talk about that situation where you go in and you find someone that they took great care of you.
Yep.
You're so impressed about the attitude that they brought to your care. They listened to you. They answered the questions that you have. In order to have a world-class patient experience, we have to offer as an organization a world-class employee experience. There is no way to separate out patient satisfaction slash engagement and employee satisfaction engagement. It's impossible to deliver great patient care in the absence of engaged employees. And so I look at my job as a leader and I talk to our executive team about how do we serve the people that are closest to the work. That's what I think is most important, Steve, is we need to remove obstacles and we need to put them in a position to be successful, right? If you're an offensive coordinator for a team, you don't have one system. You develop a system based on the talent that you have. And that's our job to do that.
Great analogy. I love that because, and that the flip side of that too is being the CEO and the executive team and manager role is remove those employees that are not following the mission of your hospital, right?
It is. And the difficult thing that I think a lot of not just hospitals, but businesses all over the
Mhm.
place for the last few years is it's such a competitive talent environment. And bringing people in, one of the things that we worry about is are we not going to take the right development and correctional issue with employees because we're afraid we're not going to be able to backfill? And I think you have to block that out of your mind. And when we look at those types of situations where someone may not be meeting our organizational standards, we first want to develop. We want to work with them. We want to try to first understand what are the barriers, why are they challenged with being able to do the things that are important to our patients and their family members and their colleagues, their other staff members. And then in the absence of that, then you have to go down the disciplinary route. And even though you might not be able to fill that slot, you still have to make the right decision and sometimes free up the future for some people that might be not be able to deliver that care in the way it needs to be delivered.
I love the backfill comment because that's when I talk to business owners. A restaurant, if I lose half my, waitresses, how do I do? Well, figure it out because the bad person in there, the rotten apple in the bushel, is going to cause more damage than not having there being short people.
Yeah, I mean,
Um,
we've all heard that statement, right? Of what if we develop our people and they leave, right? And the second part of that is, well, what if we don't develop them and they stay?
yep. Leadership is something that people look at a military, a coach, this yelling, swearing, beat down. And you have this great question. How do leaders offering kindness and love to team members impact the organization? Quite the opposite of what people see in media, in movies and series. What's your thoughts on that?
Yeah, I think the positive side isn't nearly as great of a story. And
Mhm.
it's so maybe not as good of a movie. I mean, how many movies have you gone to where they talk about loving the person that you work for and the mission in your organization? That's not quite as much fun. But what I believe deeply, Steve, is that we have to engage and we need to connect in meaningful ways. And as part of my doctoral research, I had the opportunity to meet with the CEO and team members from 5 hospitals across the country that were 5 of the best performing hospitals around the country. And so I interviewed their CEO, and then I interviewed the chairman of their board of directors, a member of their medical staff, a person that reported to them, and an hourly employee. And I found that there was commonality among these 5 people about the ways that they communicated and the intentionality that they did certain things that really rose to the top during my research. And that's really what my book is about.
And it's coming out in a few days, right? It's soon,
January,
right?
yeah, January 16th. So I'm really excited about that. It's my first book, and it's been a fun ride with Forbes.
And I love that we write in a book about those 3 different levels. You're talking from the top to the janitor, not that this person was janitor, but you could say the janitor, and what's the common theme? What was the common theme for a business owner listening?
Yeah, there were 3 things that jumped out, Steve. The first one was engage and connect at a personal level. The second was
Mm.
engage with intent through various mediums. And the third is be mission focused through united leadership. So engage and connect, engage with intent, and be mission focused. And under each of those 3 areas, there are 5 specific items. So a total of 15.
We won't
And
give all the secret sauce away. We'll give you a little bit. Got to read the book for the rest, which I'm going to read because it sounds very interesting. And what I'm hearing from you too, Dave, this can work in any industry, not just a hospital, right?
what's so cool about it is I have found that it works across industries. I've worked with banks, I've worked with school districts, I worked with a vendor for time cards and payment. And the other thing that I found that's so exciting to me is it also works at home. Because
Mm,
the research that we did, I looked at how do we serve the people that matter the most to us? And that doesn't only happen in the workplace. It happens with my wife, it happens with my kids. And, there've been a few times when, I've started a conversation, my kid looks at me and says, I'm a research project again, aren't I? I'm like, yeah, you are. But we're engaging and we're finding different ways to connect. And it's hard to do sometimes in the presence of all the various technology and everything else. We need some moments to just be there.
yeah. And I'm glad you mentioned that because you can't do business without life. Your life is going to be there. You're going through a divorce, you lost a tenant, whatever that may be, it's going to affect your business, right?
Oh, and I'm so glad you brought that up. And oftentimes we have no idea what's happening outside of the workplace, nor do we
Yeah.
deserve to know any of those things that you mentioned, Steve. But what we do know is that if you come into the environment and you're treated with love and respect, some people get a little queasy when they hear that love word. But if I listen to you and I want to know what your challenges are and what you're doing really well, and I want to know what barriers I can remove in order to allow you to operate at the top of your license, regardless of what's going on in your personal life, that doesn't hurt. Maybe
Yep.
sometimes work or school for some people can be a bit of an oasis, a bit of a respite from some really tough things that are going on.
And audience, this is why this Dave gets it because he brought the word love in, and you don't hear that in business. And I just did a speaking engagement and talked about it. People are like, oh my God, because you really, when you engage and care about your employee, you're loving them. Of course, not like your wife, but there's a love involved there, right?
Well, I think there has to be because we can feel that, right? We can feel
Yeah.
that authenticity. We can feel that transparency when we go into engagements with those people that matter the most to us. And I think even more importantly, even if you're not comfortable saying it, show it. No, I
Yeah.
think that's even more important. Make people know that the time that they spend with you can be the best part of their day. I mean, who among us does not want to hear about a story where you met with someone, they met with the owner of the business or the CEO or their manager, and that person went home that night and talked about it over dinner with their family and said, "This was really cool. Guess what happened to me today?" That's pretty
That,
cool. That's not something that's delivered by title, but it's delivered by the way we make people feel.
yeah. And I love what you said about action. You're saying a lot of great words here, Dave, because a lot of, leaders and managers and directors will go, hey, we're going to do this and repaint the bathrooms, and it never gets done. Aren't you losing engagement with your employees that way when you
Well,
don't
yeah,
follow through?
yeah, you have to follow through, right? Or one of the things that I was told as a baby CEO that stayed with me through my entire life, I work with physicians, right? And many physicians are very fast paced. Their time matters a great deal to them. They have a lot to do. There's a lot on their plate. And I was told, Dave, the worst thing that you can do is a slow no.
Mm.
if you know you can't deliver on something, tell them immediately so that they can move on. And if given the opportunity, to explain your thought process and your why. But the slow no of just leaving it out there can leave a person with the impression that A, he didn't listen to me, B, he didn't care, C, he disagreed with me, or D, all of the above.
I love a slow no. That could be so devastating. That's like being indecisive. It could do so much bad ramifications. I love that. Um, Sports. We've talked sports in the green room before. How does sports interact with leadership? There's a great question. I'd love to know your answer.
Yeah, I was fortunate enough to be able to run Division I track, and then after I got older and slower, I decided I would do endurance sports. So I did marathons, triathlons, and an Ironman, and some of that kind of stuff. And one of the lessons that was most important to me, Steve, was resilience, and that idea that the training matters. And throughout your training or your education or some jobs you may have leading up to the job that you really want, you're going to experience setbacks. On the sports side, you might have injuries. You might have someone above you that is better than you. All those things are part of it. And I think those learnings that we take from the field transfer so well over to the business place, because very few people are going to have a quick trip to All American, right? And in the business side, it's such a narrow funnel as you move
Yeah.
up through the organizational chart. And so if we know how to deal with those setbacks and remain and keep a competitive mindset, and most importantly, keep a positive and appreciative mindset, I think it does wonders towards giving you a chance.
Yeah. And that's the whole thing is you may get no's, you may not, but just the chance, the hope, the faith. I'm going to do that. And if it doesn't work, I'll do something else. Resiliency is a must. So is discipline. You're definitely a servant leader. So I want to ask you this question. What would you see if you saw somebody out there? What characteristics would they have if they were a servant leader in your eyes?
They care about people. It's the most important thing. They care about people and they have a passion for the work that they do. And that's really easy in healthcare, to have a passion for the work that we do. I think it's also there in every industry. If you know you're making a difference and you're moving the needle in a positive way and you're having a positive impact on people's lives, that's really exciting. And that's what I look for. It's hard work, and no matter what your field is. So let's dive in with both feet and let's be excited about the work that we're doing and show that to others. I think it's okay to get excited.
Yeah. Healthcare is like military and police and fire. It's life and death sometimes. How do you care in those situations?
Yeah, the line that I use is that we have to be very strong with processes and gentle with people. So
Hmm.
we have to do the right thing at the right time, because there are clinical protocols that suggest this is what gives a patient the best chance. We can't divert from those in important situations.
Yeah.
But we're also human. We also make mistakes. And unfortunately, things like medical errors happen from time to time. So our philosophy here, Steve, is that we look at trying to make sure that the processes does not allow that error to happen again. It can't be a human error. It's a process error most often. And so let's fix the process to not put that worker, that employee, in a position where they can fail.
Yeah, that's so well said. Because that's the toughest thing about being a nurse and a doctor. The worst thing that can happen is the worst thing that could happen.
Yeah, I mean, my wife is an emergency department nurse, now retired, but I can tell you how many times she came home and an hour after she left her shift, she said, "Did I chart that medication? Or did I remember to do A, B, C, and D?" Our people take that home. They care deeply about the people that they serve. And it's not making widgets. Not that there's anything wrong with widgets,
Yeah.
but we are taking care of people. And we want to put our people in a position to provide the care in the best way possible.
Engagement and caring is a big part of this too. Going back to that, because I'm hearing from you, you're engaged, you care, you show action of love. When that negative things happen, somebody dies on the operating table, because you've built all this rapport and goodwill, it's easily is it handled better?
Well, I think that in a situation like like you mentioned, where you have an outcome that wasn't expected or a negative outcome, I think the first thing you do is you bring everybody together and you tell them that we're gonna do a postmortem on this, and I apologize for using those words, but it's like the Navy SEALs going back after a mission and saying what exactly happened. And what I like to do in those situations, Steve, with any type of that, is to come from an appreciative approach. The concept in the book is called appreciative inquiry. It was developed by David Cooperrider at Case Western University, and the idea is, let's talk about if everything went perfect and we exceeded all of our expectations and just knocked it out of the park, either as individuals or as an organization, what would that look like? And how do we close the gap between what happened and where we want to be? The research shows that if we can engage that part of the brain that looks at this from an abundance perspective, as opposed to who's going to get in trouble for what they did wrong, the entire situation changes in a meaningful way.
Yeah, it changes the whole outcome on the next surgery, how they handle it and what happens, right?
Yeah, or the next engagement you have with the
Yeah.
person that reports to you, or the next salesperson that makes a mistake.
Yep. We're running out of time here. This has been incredible. I've learned so much from a different perspective of healthcare. The last question I have for you, what does the future either look like in your hospital or for all of healthcare in the next 3 to 5 years?
It's a challenging time, and especially for rural hospitals when we have 30% of rural hospitals in the United States are at risk of closing. So we have to find ways in order to recapitalize and to serve our patients. And I think we will find a way to do that. One small piece of that, Steve, is I had mentioned that I've been at KSP Hospital for a really long time. A portion of the proceeds from the book and speaking engagements and any chance I have to work with leadership teams are being donated to the KSP Hospital Foundation. And I think that's one of the ways that our communities can help our hospitals is by understanding that that need is there. And whether that's a financial contribution or a contribution of time and talent through volunteering or finding ways to even use your hospital for your healthcare, I think that's really important in the communities we have. As long as we have the communities with us, we'll find a way to be there for them.
Dave, God bless you, because that's a servant's heart, taking your money and giving it back to your hospital with the foundation. And that's what we need to do more of. Give a little bit, or as one guy says, go big to give big. I just love that phrase. Well, thank you for being on. I appreciate your time and such great nuggets you've given us. How can people get a hold of you?
They can visit my website, which is drdavidschreiner.com. They can also email me, drdavidschreiner@gmail.com. And in the book, there's information there that can be purchased on Amazon and beginning January 16th at your favorite bookstore. And Steve, again, I'd be remiss if I didn't thank you for the work that you're doing. You're improving communication around the country and around the world, and you're so skilled at what you do. Thank you for this opportunity to share my research and the work that I'm doing. I really appreciate you, man.
Thank you. You too. Well, audience, don't forget Friday, I launch my TV show, Together We Serve. And I want to thank you. And do me a favor, listen to this show a couple times. I always do when I get nuggets to make sure I got them right, because Dave threw out a bunch of stuff here that you can really take to your own business, your own life. And we'll see all of you on the next episode of Doing Business with a Servant's Heart.